Holistic assessment of the older adult. So for general health history, he's allergic to penicillin. Medical history is hypertension, cervical stenosis, GERD, chronic pain, and then he's got a decreased ability to perform ADLs with the left upper extremity due to the cervical stenosis. He does wear glasses for reading. He does have some visual impairedness. His medication regimen is Eliquis, lisinopril, famotidine, and then he is a chronic smoker and a chronic alcohol drinker. So for his physical assessment, head to toe, his hair is long and oily, does not have any evidence of balding. He does have that typical smoker's skin. It's dry, leathery. He's got some clubbing of the fingers. He does have the sclera of the eyes are red. He's got poor dentition, so he's got some missing and decayed teeth due to that he's got poor oral hygiene. He doesn't have chronic dyspnea on exertion, but he's got good days and bad days. And then he does report that typical smoker's cough that takes place in the mornings. He is unwilling to quit smoking. He's got some abdominal scarring from a hernia repair. He does report wearing Depends for urinary stress incontinence. However, he reports not having any issues with bowel movements. He does have that limited range of motion from the left shoulder to the hand, and that he's got limited grip strength in the left hand, which is due to the cervical stenosis. His gait during ambulation is steady. He doesn't need any assistive devices, and he is alert and oriented. He's able to give a pretty good history, and he understands current events. So for his psychological assessment, he does often feel discouraged due to decreased functionality of his left upper extremity. He has some, so he's got his good days and his bad days. He gets frustrated when he drops things. He does also often feel discouraged due to the chronic pain. He denies suicidal ideation or thoughts of wanting to harm himself, and states that it's against his religion to act upon any of those thoughts. He does find happiness in watching his grandchildren grow and mature. He finds joy in fishing with his son and his grandchildren. And as I stated before, he is alert and oriented. He's able to recall personal historical events as well as current. Socially, he's kind of a hermit. He does enjoy fishing with his grandchildren. He has one living sibling out of 7. He does visit her quite often. He does live with his son, daughter-in-law, and teenage grandchildren. His only source of income is Social Security. He is able to transport himself to and from appointments. He loves that blue Chevy. He also loves to watch YouTube. He watches old westerns. He listens to bluegrass and gospel music. Other than that, however, he does have 3 other grown children that he does not see very often. He's got 1 or 2 friends that call from time to time, but he doesn't really spend a whole lot of time outside of spending time with his sister and his family that he lives with. So culturally, he's a 67-year-old Caucasian male. He is divorced. His highest level of education is high school. A big thing for him is his health literacy. It's quite poor. He often needs multiple explanations of treatment plans, needs multiple encouragement for health promotion. He was born and raised on a farm, backwoods, Haymarket. Not to say that all farmers don't have health literacy. However, they just didn't put a whole lot of emphasis on medical care. They did, get the required vaccinations for school and things of that nature. But other than that, they didn't go to the doctors for regular physicals or for checkups, or if they had the sniffles. They just didn't put emphasis on that. He does believe in hard work and dedication, and believes that everything happens for a reason, as it is all in God's plan. So, developmentally, we are in that eighth stage of Erikson's theory of psychosocial development, ego versus integrity, or ego integrity versus despair. I feel like with him, we kind of teeter on the edge. From time to time, he's got some pretty bad days. He's, lost a lot of siblings, lost one of his adopted children at a very young age due to a drowning accident. And then he also has his eldest daughter who passed away a few years ago from a drug overdose. Um, so he does speak fondly of memories of the past. However, when he gets to thinking about his children that have gone before him, he does reach some pretty discouraging days. He also gets very discouraged by some of his lack of independence because of the cervical stenosis. But he does celebrate his family life. He says he's made peace with his life, but on the bad days, we know he's having a bad day. He does believe that he will see his lost loved ones in the afterlife. So spiritually, he was raised as a Baptist. He currently doesn't go to church. He does believe in his Lord and Savior. He watches sermons on YouTube. He watches everything on YouTube. He denies needing any spiritual guidance. He trusts that there's a place for him in heaven. And he does wish to have a traditional funeral. He would like to be buried next to his oldest daughter. So he's got several abnormalities with the chronic drinking and the smoking, and of course some other issues. But his biggest complaint is always going to be that left hand. He has the chronic cervical stenosis, which causes him to have decreased range of motion and chronic pain. He can't hold a hunting rifle, which is pretty devastating for him. He will still go hunting with his son and grandchildren. However, he's just a spectator. He drops a lot of objects. He's afraid to wash glass dishes anymore. He's broken several. And so it causes a strain on him because he feels like he's less independent. He feels like he can't help out around the house as much. Things of that nature. He can't walk one of the dogs because that one particularly has to stay on the leash, whereas the other three will behave themselves. So sometimes he feels like a burden because he can't help out as much as he used to. So he's got some good coping mechanisms and not so good coping mechanisms. He still does go fishing. They set it up so that there is a fishing pole holder in the kayak. And so he'll go fishing with his son and his grandchildren. He'll cast out and reel in with his left hand. And the pole holder is very sturdy, very steady. So he doesn't have to worry about his left hand. He will go visit with his sister. On bad days, also, I always know we're getting ready to have a bad day when the gospel or the bluegrass music is playing full blast. Unfortunately, so he's a Pabst Blue Ribbon drinker, maybe 6 or 7 a day. But on a super bad day, he switches to liquor, and that's generally where the behavioral problems come into play. And he does increase how many cigarettes he smokes. So some recommendations for those unhealthy coping mechanisms, some distraction exercises. He could get on YouTube, watch some old Westerns, maybe go outside. He lives in the woods. There's a trail beside the house. Just go outside, take a couple deep breaths, take a walk, or reach out and talk to someone. So my teaching plans, I would love to see him increase his physical activity. Currently, the recommendation is 30 minutes a day, 5 days a week by the WHO. However, you can't just jump into it when it's not something that you're used to. So I would love to see him, just kind of take a walk around the yard maybe for 15 minutes and just kind of gradually increase his activity. Also would love to see him take use in some thicker handles for utensils and tools. They make grippers for everything. They make thick handles for forks and knives and spoons. They make grippers for wrenches and hammers and things of that nature. And he's definitely a tinkerer. He loves to fix things, loves to build things. So I feel like he would be able to increase the amount of physical work that he does if he utilized those tools. We could put a dish mat in the sink so that the dishes don't break, or just switch to plastic microwavable dishes. That way, if he drops it, who cares? Stretching exercises, on those days where he is having some dyspnea on exertion, or chair exercises would also be helpful. So for psychological, definitely stress management on those bad days. Go outside, take a walk, take Big Blue for a drive. Mindfulness, meditation, deep breathing exercises, which can also help with the dyspnea. And then spending outside time with the dogs. Socially, I would love to see for him to know and verbalize the importance of increasing time spent with other family members. And then we've got a local senior center here in Front Royal, and they do get involved in a lot of activities. They get involved with the youngsters, with the Girl Scouts, with the Boy Scouts. They, do activities with them. They go to different places and go traveling. They go see Christmas lights. They go Christmas shopping together, all kinds of stuff. And then the Silver Sneakers at the gym, they actually accommodate basically anybody and everybody willing to come out and get in some type of daily exercise. He could also join a church community or get involved with a charity. So culturally, I would love for him to verbalize knowing and understanding the importance of health literacy, finding ways to function, utilizing those tools to increase his use of his left hand. I want him to remain independent and understand that healthcare is important, and that he receives the vaccinations necessary: flu vaccine, shingles, pneumonia, and COVID vaccines. So for developmental goal, I would love to see him achieve ego integrity. I would love for him to say that he finds peace in his past regrets, find a sense of wholeness, and start seeking out social support on his bad days, and find him seeking joy and find peace in contemplating the acceptance of death and knowing that he will see his daughter and other family members on the other side again. It's so incredibly important that he's able to live out his last remaining years in a good space. So spiritually, that kind of goes along with reaching ego integrity. I would love for him to spend some more time in nature, maybe some mindful meditation, find a church that suits his needs so that he can feel spiritually supported, and have a good foundation so that he is at peace with life. So evaluation plan would be to see that he does increase his independence, that he's willing to use those extra tools, willing to, just switch from glass plates to plastic ones. Who cares? Switch to using the thicker utensils, and then the grippers on the wrenches and the grippers on whatever else necessary that he can't hold on to if it's not got a thicker consistency to it. I would love to see that he is willing to decrease the intake of alcohol. Again, I know that he's not willing to stop drinking altogether. And to find less stress. I would love for there to be more days where the YouTube isn't blaring gospel music, or more days where he doesn't switch to liquor because he's, reminiscing on the bad days. And then to see him join a senior center, that's going to help increase not only his physical activity, but his social activity. And so that goal kind of reaches both sides. Understanding the importance of healthcare and verbalizing that he's going to get his checkups, that he's going to stay on his medications, get his yearly vaccinations, and then we want to reach that ego integrity. We want to hear him say that he expresses a feeling of peace with his life, peace with his past, and acceptance of death as being a part of life. And these are my references.